Welcome to the 5 Minute Check-in. Today is Monday, May 1st. This will be the second episode where we focus on health policy and the impact on patient care. You can see the first episode on the end of the public health emergency as it relates to COVID and also Medicaid redetermination by using the QR code or clicking the link in the description. Today's focus is going to be Medicare Advantage. This is a topic that's very much in the news these days, but I think very confusing to many people. But we're lucky today because we have a national expert with us, our own Dr. Nick Stine, the Senior Vice President for Population Health at CommonSpirit Health. Prior to joining CommonSpirit, Dr. Stine headed up efforts in New York City with NYU and Health and Hospitals to really elevate population health and led one of the most outstanding programs in the country. So, Dr. Stine, thank you for joining us.
Thanks for having me, Tom.
So, Dr. Stine, let's jump right into this. It's a very confusing area for many people, and I guess we should potentially just go over what is Medicare Advantage, particularly as you compare it to traditional Medicare, just kind of a 101 basics.
Sure. So Medicare is 4 parts, A, B, C, and D. A covers hospital care. B covers your doctor visits, your ambulatory visits. Part C is Medicare Advantage. We'll come back to that. Part D is your prescription drugs. The original program was in the 60s. Part C was added in the 90s. And then 2006 was when the Part D benefit was added.
So tell us about the Part C or Medicare Advantage.
So the main difference is that there's a health plan managing the care in Part C, the MA plan. In traditional Medicare, CMS pays directly to the provider.
So what do you see, just big picture, happening as people moving in one or the other direction over the last 5 years, and where do you think the next 5 years are going to take us?
Yeah, so there's actually been quite a bit of movement in that area. Medicare Advantage enrollment has doubled over the past decade. It's now essentially 50-50, about half of beneficiaries in traditional Medicare, half are in an MA plan. That trend is expected to continue and reach nearly 70% by 2030. So it's really changed the Medicare marketplace.
So that's really going to dominate what we think of as Medicare. And as you look at these two programs, can you give us the pros of going into Medicare Advantage and maybe some of the cons?
Sure. So from the patient perspective, the pros of an MA plan is usually there's less cost sharing. Often you have all your costs together through a plan, and they'll add additional things that aren't part of traditional Medicare coverage, like vision, hearing, and dental care. So there's a lot of appealing things to a patient about enrolling in an MA plan. The downside can be that you have a managed care plan, which is accountable for costs and brings in things like a narrow network or an HMO kind of model. You may not have as much choice in your doctors. You may have to deal with some prior authorizations and approvals and things like that, which can be a hassle and get in the way sometimes.
So you have a little more coming at you when you're in the MA program for maybe prevention and things to that effect, but more narrow selection. This is in the news a lot now. There seems to be a lot of heat and controversy going on and conversations. What is what is this all about now? What's the heat in the media these days?
Yeah, it's some call it the Medicare gold rush, and it has a lot to do with that trend of Medicare Advantage increasingly dominating the Medicare space. And so with that and with those private health plans that manage that care, you have a huge amount of investment coming in, including from private equity and venture capital, buying up different assets in care because they see those trends and they see an opportunity to have success in the program.
Mm-hmm. And where is the controversy exactly? I think it has something to do with the risk adjustment, and 2-second lesson on what the risk adjustment, the RAF is, and why that's so controversial.
Sure. So when you pay a lump sum payment to the health plan to take care of the patient, you have to have some way to adjust that amount because some patients are much sicker than others and are going to require more care, more expensive care. And so CMS calculates a RAF score, a risk adjustment factor score, based on the diagnoses that come in for that patient. And they sort of tally them up, and certain diagnoses are known to be associated with higher costs. And so the more high-risk diagnoses, the more that lump sum amount is that the health plan gets to take care of the patient. And that's why here at CommonSpirit, for years now, we've had a risk adjustment task force to make sure that we're capturing accurate, appropriate, but full representation of how sick our patients are for this program and just in general.
So let's stop for a second. And in your role as the head of population health here at CommonSpirit, how are we approaching MA, Medicare Advantage? And give me one or two things that we're doing that is unique in this space.
Sure. So, those trends in Medicare affect us as well. And it's not just a move toward Medicare Advantage. It's overall, Medicare has said by 2030, 100% of our payments are going to be value-based in some way. That might be a capitation MA plan. There are also a lot of value-based programs within traditional Medicare, like Medicare Shared Savings Program and bundled payments. We're very active in all of these spaces. And fundamentally, we look at them as very consistent with a model of comprehensive, proactive care of our patients, where we try to keep them healthy, out of the hospitals, in their homes, healthy, and living the lives that they
So
want.
that's very consistent with CommonSpirit's values in our mission. And you want to say something very quickly about in how that lines up with our annual wellness visit focus?
Yeah, annual wellness visits are really key to this for us. We see it as an incredibly valuable tool and the right thing for our patients. It essentially creates space for our clinicians and our patients to have time to talk about the most important things in their health, look forward, assess their risk, screen for depression, screen for other types of health needs, so that we can help provide those before they progress and might become sick enough that they need more expensive care.
You and I are both primary care physicians, and we know making that definitive time to have that wellness visit is so important. So, Nick, I want to thank you for joining us. I want to thank you for all the amazing leadership and work you do for CommonSpirit within the pop health space. It is mission aligned. So thank you very much.
Thank you, Tom.
So thank you for joining me, the 5-minute check-in. I hope you enjoyed this second episode in our policy updates. Looking forward, next week is Nurses Week, and I want to take this moment to thank my colleagues, those nurses who work alongside of us, taking care of our patients at the front lines, your amazing leadership, and the care for our communities over these many years. Thank you very much, and I'll see you all in 2 weeks at the next 5-minute check-in.